Thank you, and thank you for the opportunity. I think my role is going to be very straightforward and fairly simple. I think the ladies' stories and their experiences is really, really important. I know over the time frame, the last couple of years, COVID has been a very massive impact on what supports are out there to help everybody. And being savvy and tech savvy, we've learnt new ways. And we encourage you, and I think BCNA is also encouraging you, you have a voice, and your voice matters, and we are your advocates, but you need to contact us. And we're certainly here to support you in any way that we can. So my counterpart, Leanne, unfortunately cannot be here today. She is unwell. So as we've depicted, the workforce can drop quite quickly and suddenly. So please respect that we will do what we can when we can for you, but we are also human. We have lives outside of our role, and sometimes they can be over-consuming. So what we encourage people to do with the support is for, like I've said, you to take control. Okay? The doctors, the surgeons, everyone's going to tell you what they're going to do for you. It's important for you to have some control of that. You're independent people. You have made decisions and choices in your life, throughout your life, and it is not our role to take that away from you. Our role is to provide information, resources and support so that you can make the best decision associated to you. With COVID, we've found new ways of being able to relay and get information across. So we have become tech savvy. We're available and you can self-refer. So if you've gone through your specialist and no one has actually, and you've said, I don't even know about a breast care nurse. We are there for you and you can self-refer. There'll be cards out on the Wellness Centre, so it's got details of Leanne and my phone numbers. And if you go on the website, the McGrath website, you'll be able to find, you put your postcode in and find a breast care nurse and you'll find one in your area if you don't live in Ballarat itself. Telehealth, that was always a fun thing to learn, quite complicated and created some issues over our time, but it certainly was a service that we could actually see a face to the name. In my emails, I did put a photo of me, not to brag or say that it was the best photo, but it was more that there was a face to the name when we only had phone support. And I found that that was really good, and I found that my clients would actually share a photo, and it gave me a detail of their family and what their family was like. So it was lovely to encourage that. Emails was a good way of, okay, I've got something on my mind, I need to put it out there, so you put it out there and then I'll attend to it. And you've got a record, a track record of, you know, what's going on, so you don't have to remember everything that was on the phone thing. So basically what we do, we provide support right through the trajectory. So from the time of diagnosis right through to the transition to wellness. Leanne and I also provide support for ladies with advanced disease. So our area is quite big. It's Ballarat and the Lower Grampians area, so Bacchus Marsh, all the way to Maryborough, Dalesford, then we go out to Skipton Way, so it's a very big catchment area and a large number of ladies, and that's why we encourage you to contact us as you need. We will do some basic introductories, and we formulated some introductory letters, and they'll give you links, so we don't want you to go to Dr. Google. We give you links of supports, and we try and encourage you to link up to the My Journey online tool. There's also Counterpart, and you will see that they are out there, and the Cancer Victoria. So they're the types of supports that we're asking you to access so that you don't have to try and navigate. Part of our assessment will be that we now put a supportive care screening tool, and that actually helps us to work out where you're at and what your needs are. It's obviously something that probably throughout all the different clinical areas, they will then discuss that further, and you will fill them out again. You'll go, oh, not another form. But things change. Your life changes. You might have started working at the start, but you're not now having chemotherapy and you can't work. So those change, and that's important for the clinical team so that they can address that and see what your needs change. I think I've spoken about what the supports are and when we're there. Surgery is often when we will see the first time that we'll see a person that's been diagnosed with breast cancer. It may be that the surgery is going to mean that you're going to have delayed reconstruction. There's a number of difficulties in that we've found in our Ballarat area in relation to access to plastic surgeons. We have breast surgeons, so sometimes there's limitations associated to that. But what you want or what your desire is, then we need to help you to access that. So if it's getting a referral and going elsewhere, if it's actually educating you, yep, I know that I want this, but unfortunately, at the present moment, we need to address the cancer, because that's the thing that we need to do first. And just knowing that there will be and it's a slow stepping process, up and down, and that we're there for you, and linking you into the physio after your surgery, and lymphoedema is a surveillance thing that we do have access to with the beautiful Sue Eaton, and we can always keep an eye on what's going on. The Wellness Centre also offers great information about at risk of lymphoedema, and they run information sessions. All the details are out there at the Wellness Centre, and I think Leanne and I will encourage anybody that comes across to Ballarat that they access those supports. Sadly, over COVID, that was something that wasn't available. There was a lot of different support services that were then online, which is great if you're internet savvy. Great if you're not isolated. These are things that can be really, really difficult. And that's when you need to contact Leanne and myself and say, look, that's great, but I can't see it. That's great, but I don't have that. So how else can we give you that information? The other support services that we look at, so not everyone will need chemotherapy. I'm sure that Belinda's probably gone through quite an extensive amount of different types of breast cancers and different types of treatments. And you asking your oncologist about what is the treatment benefits for you is really important, because it may be that it's recommended that you have chemotherapy, but it might be, well, what are the advantages of that? How old am I? And what's your voice? What do you want to do? And what are the risks if you choose not to? If you choose to, and unfortunately with COVID, the cooling cap wasn't always available, because it meant that you were in the oncology ward longer, and that with staff being available. So linking you into services such as the Look Good, Feel Better program, and they did a great job of providing that online. So you would get your little kit and you could do it online, and now you still can. The other thing that we do encourage is the exercise, and we've got the beautiful Tracy that we can refer you to, and there's also the Renew program at St John's, and it's important because every time you have chemotherapy you get deconditioned. So the better you are, the healthier you are at the start, and if you can maintain that, you're going to recover better, and they have shown that, you know, the treatment works better. So anything that you can do, and this is what we want to do, is we want to encourage what you can do. So that's the same with a Look Good, Feel Better. If you can feel that you're looking good, then that's for you, that's your confidence, that's your ability to be able to go out and face the world. And programs such as the Why Wait for Wellness, which is a fabulous program. It has a psychologist, a dietitian, and an exercise physiologist. They'll do a generalised view, but you can also do one-on-one. These guys were fabulous with COVID and available. They did it online. There was a few glitches, but at least the service was available there. Again, radiotherapy. In Ballarat, we are very, very lucky because radiotherapy is available to everybody without a cost. You may not know that it actually costs in some other places. So it doesn't cost in Ballarat. And we can help support and link you with the social workers if you live far away with accommodation and what that looks like. The Wellness Centre is a great time because you have to go in every day to have your radiotherapy. So having access to the Wellness Centre, they offer oncology massages as such, and other supports. It's great environment is like a home away from home with a beautiful fireplace that we like in Ballarat over the winter. That can actually, makes you feel that it's not so clinical. And you might see the volunteers and you might see a familiar face. And having a familiar face when you're going into something that's daunting is really nice to do. Then we come through. During our pre-COVID, we used to run a program as we transitioned into wellness, and we would invite different speakers, guest speakers, to talk about all the wonderful things that can happen with endocrine therapy, such as vaginal dryness and all these kind of things, and exercise physiologists and social workers. During the COVID time, that wasn't available. So we formulated a written form. Again, we will then do the supportive care screening tool at that time as well. And that allows us to ascertain where you are and where you're at that particular time. So I know it's like, the breast care nurse has sent me out something else, and I have to fill it out. But it does help me, because it helps me to say, okay, look, I've had a look. Looks like we need to catch up. Looks like, these are becoming issues or concerns. How about we have a chat about it and see what our options in that are? Because I'm saying to you that you don't have to suffer in silence. But I can't help you if you don't tell me. And we'll link you and let you know about things such as the chronic care pathway that you can work out with your GP, so you get access to podiatry, allied health services as well. And then there's some fabulous support groups around that we will put in there about the Dragon Boat ladies. So I hope everyone's nice and strong and ready to paddle and show Ballarat what we're made of. Other things such as the Otis Foundation is an opportunity to actually have a break and Airbnb kind of. So everyone, it's a service that's available to anyone that's been diagnosed with breast cancer. You just need your breast care nurse to sign off on it, and that's about it. So I think the beautiful Renee is actually going to share her experiences. So both Renee and Carol did basically go through their treatment trajectory with the experience of COVID. So I think having two different age groups, two different responsibilities in life and even environmentally is really good for you guys to get some insight and some tips. And I think it's the most important part of this talk. So I'll let the beautiful Renee come up and have a chat, and she'll tell you a little bit about her story and then some tips there. Thank you.
Okay, to start off, if I say anything and you've got any questions, please write them down. I'm very much an open book. I share everything. Nothing is off limits whatsoever. So any questions you've got, please don't hesitate to ask. So it was the start of 2020 for me. It was January, and I noticed a lump in my left breast, and I went straight to the doctors and I got an ultrasound slip to go and get it looked at. I put the ultrasound slip in my bedside table and left it there. Being 33, I was like, I'm too young, like it'll be nothing. I actually had a mole removed from the same type of area, so I thought it was just a little bit of scar tissue, to be honest. Then it got to the April, and I noticed that the lump had gotten bigger. At this stage, I was 12 weeks pregnant, and I just assumed that it was my milk ducts, but I went off to the doctor and got a referral for a scan, and I actually went and had the scan done. The scan got sent off to a breast surgeon in Ballarat, and she had a look at it, and she's like, look, I think everything's fine, but I am going to take a biopsy just to be sure. So she took the biopsy, and 2 days later I was sitting at home playing with my then 2.5-year-old little girl, and I got a phone call from my GP, and she was in tears. She was like, you need to call the breast surgeon, you need to call her right now, you need to get in and see her. And I was like, what's going on? Anyway, so I got in to see her, but I rang my doctor back in the meantime because I was like, there's no way I can drive from Bacchus Marsh to Ballarat and not know what the hell is going on. And she said to me, it's come back positive for cancer and you're going to need treatment. So here I am, baby in the back of the car, hubby, mum, 12 weeks pregnant. I head up to Ballarat. I think this is the part of the story that probably gets me the most. Hubby and I having the chat on the way up here, whether to terminate the pregnancy or what to do basically. We had no idea like what we were in for. So we get up to Ballarat and saw the surgeon, the breast surgeon, and she was like, "Oh, no need to terminate. Like it's obviously doesn't happen all the time, but yeah, no, it's fine. I've got an oncologist here on the phone who really wants you," and I had Leanne, the breast nurse, there on the phone as well, and it was all good to go. So they did send me across for a mammogram as well, but obviously being younger, the ultrasound seemed to work a little bit better because my breasts were very dense. So yeah, I was booked in I had to have surgery first because I was in my early stages of pregnancy. I couldn't start chemo right away. So at 15 weeks pregnant I went in and I had a lumpectomy. I wanted both of my breasts gone, I'm not going to lie. As soon as I heard that I had cancer, I was like, just take them, I don't need them. But she was like, no, it's all good, we can just do the lumpectomy. So they did the lumpectomy. I had a 3.4 centimetre tumour in my left breast. It was actually stuck in a milk duct, and it came back that it was triple negative breast cancer. I'd had 2 IVF pregnancies, so I thought for sure that it was going to be a hormone-based cancer, but no, it came back the triple negative. So after I had the lumpectomy, I started chemotherapy. So I was 17 weeks pregnant and I started chemo. I started off with what we like to call the Red Devil, so the AC. So I had four sessions of that over an 8-week period. And then I started on the Taxol. So I had 12 weeks of Taxol as well. That brought me up to 36 weeks pregnant. And then 4 days later, after my last chemotherapy, I gave birth to a beautiful little boy named Jagger. Unfortunately, because I was pregnant, I couldn't have all the scans to see if the cancer had travelled or anything. I did know that my lymph nodes had come back all clear. So as soon as Jagger was born, like after a couple of weeks, I went and had all the scans and everything to make sure that nothing had travelled, and all of that came back okay and all good. So he was born in the October, and then in the December I had to do a month of daily radiation. After the daily radiation for a month, I then started an oral chemotherapy for a year. I think that probably knocked me about more because I had a baby and a toddler I was running around after, and everyone had gone back to work. I was very, very fortunate that my mum took 9 months off to help look after me. She was meant to be travelling around the world, but of course COVID jumped in and she couldn't go on holidays. So she still took her leave and she stayed home and looked after me every day. But yeah, I think for me the oral chemotherapy seemed to knock me about a little bit more. Lots of horrible side effects and things like that. But I was very, very fortunate. I have the best oncologist in the world. I think like my husband is in love with him, my mum is in love with him, like we all just adore him. He's absolutely beautiful. I had the amazing Leanne as a breast care nurse, so I would flick a message through to her and she would be straight on it. She set me up with a lot of support networks. A lot of things were shut during COVID, which made it a little bit difficult. Like I didn't know if I really wanted a wig or anything like that, but I couldn't go and try anything on because of COVID. So I just rocked the headscarves and the beanies because Ballarat's so cold. But she got me in touch with those of you who have children with a organisation called Mummy's Wish, which were absolutely fantastic. They sent out care packages for my children. They sent out these gorgeous little teddy bears and I could voice record my voice into the teddies for them. I got to choose whether I wanted meals cooked, petrol vouchers, a house cleaner, a gardener. They were absolutely amazing. Obviously, the BCNA, My Journey, I linked into that as well. The Look Good, Feel Great, I got sent a beautiful pack from them too. So there are a lot of support networks out there. It's just having a look around and obviously having a chat to your breast care nurse. I knew nothing coming into this. Breast cancer does not run in my family. My 75-year-old Nana had never even done a breast check before. So it was all very, very new to us. Yeah, I don't know. I think that's about it. That's trying to put it in nice and small.
Okay, so just a bit of background. I live in Bacchus Marsh. I didn't know Renee at all, and she lives in Bacchus Marsh too, so wonderful. On 20 acres, a widow for a long, long time, so living on my own. No history of breast cancer in the family at all, so completely a shock when I was diagnosed as well. And you people who've had the diagnosis, you would understand the shock and the denial that you go into. Similar to Renee, yeah, I found a little lump, but no, I'd had something similar about 5 years earlier. I'm not going to worry about that. I've got other things to do. But then what happened? I was due for my mammogram, wasn't I? Thank God for that, because within a couple of months, yeah, the answer came back, yep, it's cancer, and yes, it's estrogen triggered. So different to Renee. And we began the journey. And you know what? When I was a kid, I used to love going on the roller coaster. And that was the feeling when I started the treatment. It was like, hang on, here we go. We're going to have a bit of an experience. It's not going to be fun, but you can do it. And I was reflecting on this, getting ready, and I thought, why is that? It's part of my life. Like, I've been a widow for 25 years, bringing up the kids on my own. Part of that was, yeah, come on, Carol, you can do this. The buck stops here. So it gave me that little bit of confidence, I guess, that I could get through things. Well, I've got to refer back to the notes, sorry. Then, yeah, as well as that, this little girl, this person here, has white coat stuff. Anyone familiar with that? When you go to the doctor, your blood pressure goes through the roof? Yeah? I've got a few nods, yes. Well, that's me. So anything to do with hospitals, care, doctors, the poor nurses that dealt with me in chemo, the blood pressure would be through the roof, and I'd say, I can't help it. So I looked at this too as well. Maybe I can overcome that, because that's what else can you do, you know? Now, so fortunate to have the beautiful Joylene here from the very word go, from the first consultations with the oncologist. She's there. And being a widow on my own, travelling to the hospital on my own because of COVID, how irreplaceable to have an advocate. So for me, it was 2 surgeries. First surgery, just a lumpectomy, and they thought it would be fine, but no, it wasn't. It was spread further in the breast and the lymph nodes. So removal of all the lymph nodes. A second operation, again a lumpectomy, and again there was that choice. What did I want? And I found that respectful too, but scary as well, because am I making the right decision? Should I just have it completely removed, But so far so good, we're doing okay. And again, the chemotherapy, and I guess it was that first appointment with the oncologist, people who've gone through it, when they say, this is your treatment, 12 weeks of that, 12 weeks of that, then radiotherapy, and you go, what? What the? This is going to be my whole year, and it is. It's a year, and it's going to be good for you in the end, My chemo was the first round were every 3 weeks, the heavy stuff, as Renee said, the red stuff, what do you call it? Oh, the red devil, yeah. You know why that is, people who've had it? Your wee red stuff when you go to the toilet. And that's the heavy stuff. Oh, isn't it ever? And I think the first and second sessions, I was on the phone, wasn't I, to you? Straight away, help, just for different, I don't know, how shall we put it? bowel situations. People who've been through it, you know what I mean? So yeah, there are some nasties with that one. The second lot of chemo, it was once a week for 12 weeks. Much easier, much better. And aren't the girls beautiful at the hospital? Oh, those nurses are just priceless. And being in COVID as well, I think when I went for treatment, because I was on my own, it was talk to me. Let's talk. I talked to all the nurses. And just enjoy the interaction as well as not enjoying the treatments. After that, it was the radiotherapy daily for 15 sessions. And at the end of it, you're shouting, hallelujah, got through it, which is great. Through it all, I was again so relieved to be able to talk to Joylene too about supports, you know, and one of the first things I latched onto, and I think I'm an ex-teacher, I'm a retired teacher, and teacher's brain goes strategies, okay? So I'm thinking, what strategies can I put in place to get through this, right? What can I do to help myself? And BCNA have got it set up, right? They've got the supports there that you can link into to really help. And one of the first things I really wanted and asked for was, I need something for my mind, right? My thinking, because I could see this as a negative experience only, or I could try and help my mind thinking on other things or thinking of ways to get through. So I asked Joylene to put me in touch with a counsellor. So straight away got into talking to a counsellor on Zoom, or if not, and often the Zoom would go in and out because of my internet at home, and that's the problem with being a bit isolated where I am too. But we could talk on the phone, if not Zoom. But again, she would give me some perspective on it, and it was someone else to talk to when there was no one in the house, right? So, and people will know too, when you're going through this or any major crisis of some sort, some people, some friends you can talk to, some people you can't talk to. And that's no reflection on them, it's just some people can handle the big C and some can't. True? You know, and I would have been in that same boat, I think too, a little bit scared of talking to people who are going through cancer, because, you know, it's scary. And what if I catch it? You know, and I really got that impression from some people. If I talk to them about cancer, they're going to think they're going to catch it from me. It sounds ridiculous, but I think it's true. So I would be selective as to who I talk to and how much I talk to them about what I'm going through as well. You can tell some people just can't handle it. But there's always someone else I could talk to, which was fantastic. Yeah, so one of the strategies for me, it was, well, how can I come through this? And I'd been through the loss of my husband years and years earlier, and I remember thinking, how can I get through this the healthiest I can be? Not perfect, but the healthiest I can be. So the counsellor was looking after my mind and my, you know, my thinking, and then it was, okay, what about the physical? And again, the support was there. I contacted Joylene, I think, or she might have mentioned it to me, the physiotherapist. Okay, so we can get onto the physio while I'm going through treatment. So how is that going to work with COVID? Oh, okay, try Zoom. So it was the funniest thing, because you've got I'll move away from the mic, you've got the physiotherapist demonstrating for me, and then I've got my camera, my phone aimed at me trying to show her I'm doing the same thing. So it was really funny, but then they sent through the hard copy and I could follow the exercises, you know. So that was really helpful and a focus, and I was scared of walking down on the river where everybody else was walking with COVID, so I just walked on the veranda, up and down, on the timing it. But with music as well. So I used music to help soothe as well. So there were strategies in place. Now, one of the really vital things was that connection with people, family and friends, And a way of doing that too, I actually scheduled it. I thought, I'm on my own, I'm isolated, I have to talk to people. So I would do a weekly schedule, sounding really a bit too organised, don't I? Every second day, talk to someone on the phone. Not every day, 4 people, every second day, so I could space it out to have that conversation about other stuff, other things, their interests, their lives, instead of just focused on the cancer. So that helped to get through as well. Let me see. So we had the counselling, the walking, the Zoom chatting. The daily routine was another thing very important. The daily routine of when I felt well enough. As you know, with the chemo, maybe for 1 week, can hardly get out of bed. Then a couple of weeks you're feeling better before you go back to your next chemo. In those times it was, today I want to accomplish one thing, just one thing. So I feel good about myself, I've achieved something. So one thing would be clean out that bloody cupboard. Just like in COVID everybody else did, polish that bench, just one little thing to have a sense of achievement. The other thing I did on Zoom was look good, feel better. And the internet was not so good, but that was fabulous as a support, because part of that journey too was, no hair, and the little caps and the scarves were beautiful, but how do I feel about myself? Looking in the mirror. And I tell you what, that took a long time to come to terms with, but that program really helped, and I ended up getting a wig online without seeing it. And I wore that for about 12 months, just to make, when I went out of the house, just to make me feel better. So all those things, those supports were really, really very good. The side effects, ongoing challenges. Oh yeah, we've done a lot on that today, a lot. And I must say, that was very, very difficult. Coming out of all the treatment, I was singing hallelujah, and I celebrated and went out with friends and continued to celebrate for 12 months, and then hence put on a lot of weight. But after that, emotionally, for me, it was like, I think I was saying to Renee before, getting through the treatment, you're hanging on, getting through, I've survived, I've done well, then crash emotionally. And I thought, I'm so sad all the time, and it's a grief process. And again, the counsellor was still there to support me through that, talking through, I've lost the person I was. I was this energetic, didn't have side effects, and now I've got all these side effects, sore joints, all sorts of stuff going on from the medication. What do I do with that? So I found the counsellor talking through that was very helpful, but then I got to a point of going, okay, I accept this. This is the new me. And that's just my experience. I can only talk from my experience, and it's different for everyone, but I've seemed to have come through that now to a point of acceptance, and going forward I can take the medication, manage side effects. So again, drawing on the GP, the oncologist, to say, how do I manage these side effects? What do I do? And I guess that's where I'm at the moment, right? And it's about 14, 15 months since finishing treatment, but still on these tablets for the next whatever. Now, I think, just in closing, I would say 3 real things that are really advice, I guess. One is to ask for help, right? If you're not sure, ask for help, ask. And for someone like me, absolutely fiercely independent, fiercely, I do not ask for help, right? What a learning curve, okay? Have to ask for help. I had to ask for help around the home, but going through the treatment too, to call on Joylene, to ask people, what do I do here? I don't know what to do. Tap in, link into the supports that are provided, with BCNA. They've already thought about all those things that I've been talking about and got it all there. It's all there to access, so. And the other thing was, you know what, just look after yourself, look after you. You're the priority going through treatment. And I thought, well, no one else is going to do it. I've got to look after me. So, and just take those steps. The other thing I wanted to say is what special people we have in this field. You know, the doctors, the nurses, the beautiful breast care nurses we've got here. They're professional, they're caring. You know, it has to be someone special, doesn't it, to work in this field? I couldn't do it. I couldn't take on people's issues and their emotions and all the stuff they deal with. So
thank you very much. I hope you got a lot from those stories. They were from the heart, and I think, you said it as it was. So I really appreciate your honesty and sharing your story, which I hope resonates with some people and gives them some way of helping them. So we can open now for questions. If anyone's got any questions that they would like to ask any of us. I've got one microphone working. I'll see if I can get a couple others.
Your mates, how did they cope?
They were pretty devo, I think. Being so young, they kind of all went, oh, this could happen to us too. To be honest, at the start, when I was, I guess you could say, grieving a little bit, I got a bit dirty towards them, because I was like, well, here I am, possibly, well, I shouldn't say that, but maybe going to die, and they're going to be here watching my children grow up. So I was a little bit shitty at them, I guess. But no, all good. I love them beyond words. Absolutely amazing. Bacchus Marsh, is the most amazing little town. They did an amazing GoFundMe. I got petrol vouchers from the local petrol stations to drive up to Ballarat every day. Some people did get a little bit afraid and didn't know what to say and a little bit standoffish, but I'm like a massive open book. I say it how it is. I remember one time, we didn't have many visitors over because it was right in the middle of COVID, which I guess was a little bit beneficial because I couldn't catch anything off anybody. But I remember one day I had a girlfriend of mine over and Mum's like, oh, Renee, do you want to put the kettle on? And I was like, oh, I can't, I've got a tumour. So I'm a little bit sick like that.
I feel like there's going to be conversations at every family dinner tonight. Sorry, I had a tumour.
Yeah. Well, now they're like soon as I got it removed, they're like, not an excuse anymore. So yeah, no, they were pretty good. I've got a very, very good support network. Two amazing brothers, and their partners are really great. So I was very, very lucky.
Awesome. Keep asking. Put your hand up if you've got questions. Joylene, I'm going to ask you one about sexual well-being, the conversation that no clinicians want to have, but I know breast care nurses are much better at doing.
We're great at it. We're great at it. We're great at it.
Give us your best tips.
So best tips is to first let your breast care nurse know. Now we will ensure that you will ask you some quite personal questions, ask if you're using moisturisers and lubricants as such and how often you're using those. We can also refer you to, if you're having painful sex and things like that, we can refer you to our physiotherapist who might have some introducers and stuff. So we talk about lot of hot stuff, and I think it is a very personal thing. So I think the way that Leanne and I have worked out to allocate clients to us allows us to build that rapport up. So when that comes to that time in your journey as such, that at least you've got a rapport up. I kind of can know, married, not married, what your relationships have been with you and your family and things like that, and just your social overall well-being. So it's certainly something that you can feel comfortable with, and filling out the questionnaire that we do with that transition at the end gives us the indication. So there's a menopause rating scale on that, and on that we'll have things about vaginal dryness and sexual pain and pain during sex and things. So that helps to drive us, and we can go, okay, let's catch up and have a little chat about this.
Carol, don't worry, I won't ask you about vaginal dryness, but you can talk about it, of course, if you'd like to. It's completely
No, I'll
up
pass
to
on
you.
that.
You talked about that challenge as being a teacher and then going to ask for support. How did you actually get to there? Because I think everyone who's been down the path kind of goes, you've got to ask for support, you've got to reach out for help. But it's easier said than done. What was it that you kind of did that made you realise you've actually got to ask for help?
I'm not really sure. I just couldn't manage on my own. I just, and that's the truth. Living on my own with the family were wonderful. I mean, they lived locally, but with COVID, they couldn't come in the house, so it was feeling very isolated. And And I think the survival thing clicks in. To survive this, to get through this, come on, you've got to put your pride away and you've got to ask. And I think because Joylene was there always to sort of phone or contact, that was great. But it was more than that too. It was still the reaching out to friends, and they would offer to do things. And my personality is, no, I can do it myself, all right? But I said, yes, thank you. And did I feel obligated? Yes, I did. But, people want to give, people want to help, they're just lovely. And there was one lady who used to do all my shopping, a friend, and she's still a friend. We're going on holiday soon, Tassie,
Nice.
which is great. But, and I guess they don't know what to do, but gee, that matter, the fact that I was isolated, really, yeah.
I want to pick up, I'll stay with you, I want to pick up that question around getting friends to help, because I think overwhelmingly everyone says, how can I help? And you're just like, actually, that is the biggest burden you can put on me, that I actually have to come up with the strategies for you to help me. So what are some practical things people can get their friends to help? Because people do want to help, but they don't know what for
me it was the shopping.
Yeah.
And I had it delivered, but then there always be stuff I forgot, of course, and...
It's always the ginger, I reckon.
Yeah.
Pot of ginger. It's really annoying.
It could be, but shopping, even reading material if you're up to it, things like that, bringing books and things, but conversation too, if you're isolated, you just need someone to talk to, even if it's a distraction from what you're going through. That was really important. Just a phone call. And I used to have people that are friends, because I'm a believer, a Christian, so that they'd say, I'm praying for you, and that was really important about that spiritual support too. That's and cooking, but I was phobic about that. I was like, in the early days, people were cooking and I'd throw it out. Because I was worried about COVID. Didn't know how you get it, is it possible or whatever. As time went on, I would accept some, but initially I didn't. But that's another way to help as well.
I do quite a lot of media interviews, and one of the things that I quite often tell people is, please, whatever you do, don't drop around spag bol or lasagna. Because... one, you've got too much of it, but also if you've got little kids, what I've worked out pretty quickly is kids only like their mum's mince and tomato sauce. Like however we make it is how they want it. And so I think giving people some practical tips, and we've tried to do that through my journey, but also on the online on the website, about things to think about for people. Like if you've got someone in your life who's really skilled at finances, in going into all your insurances and looking at what opportunities exist there. And I think they're some of the things that we don't necessarily think about how people can help us. So I want to encourage people, if there's tips you've got on how to get people to help you, we want to hear all of them and share them. I know one of these forums made us develop a recipe book with Suzanne's on all the other meals you can make except spag bol, and all the ones that you could freeze. So that recipe book is still available, and it was all the members' favourite recipes during treatment, which I thought was good. I know we're going to stop for lunch, but Renee, I did want to ask you about, we know that partners can have a real time with how to cope. obviously having a husband, we know that men like to fix things. And this isn't something that they can fix. How did he kind of navigate this whole situation?
Yeah, so at the start, so my dad passed away 6 years ago from melanoma. And my husband was holding his hand on the bed there as he was passing. And he was like, I will look after your family. I'll protect your daughter. Your whole family, I'll look after them. So when I was diagnosed, he was like, I promised your dad, that I would look after you. And I can't do anything. It was really hard because of COVID as well. Trevor could come in for the first couple of sessions of chemo, but then I was in there on my own. So he couldn't even, that really, really annoyed him. He got really, really mad. But look, the poor bugger had to work full time. I was off. I'm a trainer and assessor, so I was doing a little bit of work from home. But yeah, he had to work to support the family. We do have a really good support network, so he could talk to a lot of people about how he was feeling, things like that. But I found, because Mum moved in as well, it was great times, I found that when I was down, that Mum and Trev were down as well. If I was struggling, they were really struggling. So I tried to be super positive and really with it, and then they were happy and they were fine. So
that's an enormous burden for you to carry.
I know, but I kind of felt like obviously being pregnant, this is going to sound really funny, but I kind of felt like I got a prize at the end because I got a baby. Not many people get that, you kind of finish your journey and that's it, but I got a present, I got a beautiful little present. So
We'll all be asking for diamond rings at the end.
I know, right. But look, it was very, I think my brothers struggled a little bit looking in, obviously seeing somebody with cancer and seeing them bald or with a headscarf and things like that, it does kind of, when you see somebody you love looking like that, it does kind of take your breath away a little bit. But then seeing that and then seeing the person pregnant as well, growing a baby, it was very hard for them to see, and my brother-in-law as well, he was very yeah, so, but no, they were very good, and my husband is he would bend over backwards for me, he would do absolutely anything. So yeah, I was very lucky. And with my symptoms, I didn't know what was pregnancy and what was chemo, to be honest, because a lot of them are linked, pretty much the same. So I would ring Paulie Ann and be like, oh, I've got the runs, or I've got this, or I've got that, and I'm vomiting. Oh, I don't know, is it pregnancy or is it chemo? So it was very,
a tricky time.
It was.
We are, we've just, in the policy and advocacy team, had a recent meeting with an incredible young up-and-coming oncologist who wants to set up a service at Peter Mac specifically for people who are pregnant and breast cancer. And I think that your example today is exactly why we need to do it, because there are some unique support services that we need to wrap around you, and we want to find a way to help you all connect as well so that you can support each other. And yeah, I think one of the things we know is, and we've touched on it around Belinda's presentation as well, but to know that you don't need to be referred in to the McGrath nurses, that you can self-refer, and we need to encourage people to pick up the phone and connect in when they need that support.